This is the education module for image trend delete. You'll log into the HCEC website, go into the employee tag, scroll down till you see the Elite image trend delete demo field bridge. For your first login as a new employee, your username will be first name dot last name. Your password will be capital H lowercase CEC, your 4-digit employee number with an exclamation point. And you'll click sign in. You will choose the Harris County Emergency Corps drop down, hit continue. This is where you'll add your crew information and your unit and shift information at the beginning of your shift. If there's already selections made, click the remove button, remove them, along with your units and your call sign and your shift. Then you can go back and add your crew member. Don't worry about the level, it'll auto-populate within your record. Your unit number will be your shout number. Call sign will be whichever medic number you will be for the day. And then which shift that you are, A, B, C, D, or if you're at a venue, first aid venue, hit OK. You will now click to add a new event. At this point you'll see that everything is red for validation. This is where you will download the CAD information, so click download CAD. And if you're looking for this date, you just choose your date range. You can clear dates to go as far back as you need be. You can search by incident number here. You can also change the call sign to make it a little easier. If you knew you were on Medic 92, you could choose that. And then you would click download. You now see that the incident number has been downloaded. Your EMS response number will be an automatic download, so you won't have to worry about that. And that should be everything for that section. Your dispatch information should automatically populate. Priority is what dispatches you to, so 90% of the time be emergent, unless you're going non-emergency or with a scheduled transfer. Both of these should auto-populate once we get it fixed within the CAD system. Unit info should already be in place. We have this set as defaults. If for some reason the primary role of the unit is event standby, then you would click that. But as ALS transport is the default. Incident address, it's already populated. You have to pick a location type. So if it is a single family home, you would click that, street or highway. If you're picking up from an apartment, airport, whichever it may be. So that tab is complete there. Crew information, you have to have a caregiver during scene and also during transport, and somebody has to be a driver. You can multi-select within these. So we could have a driver, and then you could have a primary care on scene and a primary care on transport. You're finished with that tab, it's done. Go to the en route tab. If you had any delays, you would put it here. If you click this button here, all your information comes here. If you click this button over here, it puts it over here. It's easier to see. If there's no response and delay, This will automatically populate. If something's different than normal, if dispatch downgrades you or they dispatch you non-emergency, or if you dispatch non-emergency and it's upgraded, you can just change the button. It's defaulted to lights and sirens. If there's something different, you can always change it. So that is completed. On scene, as of right now, the number of patients at the scene is clicked to none. So there's nothing else on this side that deals with patients. You have to have a patient to be able to do assessments. So if you click single, now all the information shows up. If you click multiple, your MCI information will show up, your triage classification, and also this is where add a patient to the incident shows. So if you click single, if you have other personnel on scene, for instance the fire department, you could put the fire department in, it puts their dish number in, click OK. And if you have an MVA or whatever it may be, you can put your law enforcement case number here. Or you can change that to other. And then if you have a CPS or an adult protective services or anything else, you could put in CPS and then put in the number and it'll save within your record. So that is your scene information. At this point is where you're going to decide what your disposition is, or is this going to be a refusal? Is this going to be a transport? If it is a transport, it is a treat and transport ALS by this unit or BLS by this unit. Once you do that, you'll notice that some other tabs now start opening up. The next tab is patient. You can fill in the information as you go. We tried to put everything on one page, so you didn't have to click page to page, or you can actually find a repeat patient. You can do by first name, last name, date of birth, social security exact, last four of the social, any way that you want to search for, address. But before you download one of these, you need to make sure it is the correct patient. Once you find the correct patient, you can download. And then all of their information that was put in the last shows up. Body, weight, address, phone number, closest relative. If you have one, you can put it in here. If it was pre-populated in the last record, it will auto-populate into here. Patient medical history. Their previous history has already been saved as a repeat patient. You can also free text anything in this that needs to be done. Who did you receive the history from? Did you get it from the patient? Was somebody on scene that's not family, was a family, or did you pick up from a healthcare provider? The next section, does the patient have advance directives? If you click yes, it's going to ask you which directives do they have. This is a multi-select, so you can select more than just one. Do you suspect drug or alcohol use? If you hit yes, why do you suspect it? Again, multi-select, so this helps. There's also a name for the patient's physician. So you can put that in there, and you can also put next to it the phone number for any reason that you think it needs to be there. Medications. The information from the previous record is here. You can also click here, and you're going to search. You can start typing in the name, and hopefully it starts to show up here. And then you can add it if need be. Just close this, and then the allergies. So the patient's already allergic to morphine, the same thing, you can go to that. Or if there is no known allergies, you can click this minus button and click no known drug allergies. You don't have to search for it. This is just able for you to write in any comments to this. If you had an allergic reaction or if you knew that there was environmental allergies, you can click here. You have ant stings or pollen allergies or whatever it may be. So you're done with that. Okay, we're now at the point for patient assessment. The first thing to do to make the report run a whole lot easier is to go to your time tab over here and put in your patient contact time. If you click this button, well, it should have set it to the scene time, but we'll just change this to, so arrived on scene 11:55, so patient contact we'll say was 11:57. There we go. At this point now, once we finish this, once you go into your assessment tab, now we can start. When we go to add times, you'll have this bar that comes up, and you can begin your starting times at the current time, an on-scene time, patient arrival time, or destination time. So symptom times, so you got there at this time. When did those symptoms start? So we'll say that they started an hour ago. Patient complaint. So an hour ago. Add complaint. Whoops. Okay, so I believe this is a little bit backwards. I may have to readjust this. If you add the complaint, it's going to ask for the time. Your chief complaint is what the patient actually told you. If you have a secondary complaint, you can add secondary. So your potential system, so this would be like a trauma, stroke, airway, burn, whatever it may be. If it's not on here, then you can just hit other. Again, you can do it here or you can pull it up to the side so you can see better. So your chief complaint, anatomic location would be head, and system would be CNS neuro. You're done with this tab. Symptom impressions. What is your primary impression? This is for categories. So if we're choosing the CNS nervous system, was it a chronic or is it an acute pain? Migraine, seizure, stroke. So it's acute pain not elsewhere classified. Your secondary impression. And we'll say that they had a fever. Primary symptom. Again, general signs and symptoms. Whoops. Dry mouth. If there are other ones, you can put them in there, or you can put not applicable. Is the patient stable, emergent, or critical? Was ALS assessment performed or warranted? Yes. Do you suspect a STEMI? If you're going to do a 12 lead and go through the STEMI triage, then you suspect a STEMI. Doesn't matter if it's yes, if it's positive or not positive or inclusive. If you suspect one, so you're going to do all of the testing to see if they are having a STEMI, then you click yes. Otherwise, leave it as no. Same thing with stroke. Click no or yes. Possible injuries. If anything happened, you would click that. It would open up the tab. If you picked a stroke, the stroke tab will open. You will add a stroke assessment. The scale type is automatically defaulted. Did you triage them? Yes. This can all be normal. And then you would come back with negative. Back to your symptoms. The same thing with the STEMI. Same thing with an injury. If you click yes on injury, now you have your injury information, your collision information that populates. Was it a cardiac arrest? No. Now you go into your vital signs. This one has a red box around it only because you need to make sure it's obtained prior to EMS arrival. If you click this, the people that are on the crew will show up first. You can add anybody else in, so if a supervisor shows up, you can actually add them. Patient position. A lot of this should auto-populate when you download your monitor. At this point, this is everything, every vital sign that you could do. Once you put in your blood pressure, it will automatically calculate your map. This is your pulse ox qualifiers at room air if they're already on O2 1 to 6 liter, 7 to 9, 10 to 25. So we'll do this at room air. If you have your end-tidal on your temperature, how did you take it? In Fahrenheit, it will auto-populate your Celsius, your level of responsiveness, your Glasgow Coma scale. Click your numbers, auto-populates and adds for you. If there's a reason why this number is low, these are your qualifiers. If there is nothing, you would click that. Pain scale, you can put your number here, hit OK. Now, under your treatment tab, your medications, where it says all medications, you can click this. Is medication prior to you getting there? No. This is where you can choose whatever medication that we administer. Or, this is a place segment for our CPR meds. Underneath this is all medications that could be given during a CPR. This is also just a placeholder, so it doesn't count for anything. It just kind of gives you, separates that all the drugs that be given an RSI and etc. So if we give epi, was it prior to arrival? No. Should auto-populate in which way? If you gave it IO, you would just change it to IO. Medication dose. Did it improve? Was there any complications? If there was no complications, click over here, not applicable. Actually not recorded. and if you have any comments. Click OK. Again, on this, it auto-populates the time as the time that you made patient contact. If you need to change that time, just hit the time and you can add a couple minutes. Under your procedure tab, again, you'll search for whatever procedure that you have done, and there is a lot of procedures. So I would suggest you probably don't use this part of it unless you absolutely need to and you can't find it anywhere else. Do your narrative last, and I will show you later why you should do it last. Over on your right side is your power tools like we had before. Your assessment tab, this is where you assess the body parts. So your skin, you can click normal for patient. If more explanation, so your capillary refill was good, skin was dry, but it was hot. At this point in the details, if you can't find what you're looking for here, you can always type it in right here. This is free text. Who did it? And then again, you can change the time. Hit OK, it saves it. This vital sign tab is the same thing that you saw over here. It's just laid out in a different way, but it's the same exact thing that it was before. Medication tab, same thing. You can search for it this way and you can do it this way. It's your choice, whatever you feel more comfortable with. Your ECG monitor, if you're unable to download your monitor directly into your record, you can actually click it in here. This actually is everything that deals with a monitor. The difference here when you, and I'll show you later, when you open up the timeline and you see a 12 lead done, you can open it up here and then you can choose was it left side or right side 12 lead right here. On your IVs, everything to do with starting an IV. Was it done prior to EMS? No. What size catheter? Where did you start it at? Number of attempts. This should always be 1. If you get it or you don't get it, always 1. So for every attempt, you should do a power tool. If there's any comments you want to put in here, you can put it there. Prior to arrival, no. You can change your time. We're not going to change any times right now, and I will show you why in a little bit. Anytime you start an IV, you're always giving fluid. So if you're only doing a saline lock, you're going to put 10 milliliters. Complications, none. And then hit OK. IO works the same way. Oops, hit the wrong tab. So basically the procedure will be an IO, but everything else will show up the same way it did for your IV. You have a ventilator tab. That's specifically set for putting in your settings. So your mode, put in your setting, your ventilator rate. So if this is SIMV, your rate, tidal volume. So this is the tidal volume set. This is the tidal volume that was given. Most of the time those numbers are going to be different. your high pressure, your low pressure, and if you have PEEP-Apply. If you don't, not recorded. Was it done prior to arrival? No, no, no. And you'll get used to this as you start going through the process. And hit OK. If you do an airway, now that you've finished the ventilator settings, you go into your transport destination info. Transported one patient. How did you transport him? Emergency, emergency, then downgraded to non-emergency, non-emergency, or an upgrade. Lights and sirens, if it's emergency. EMS transport method, be ground ambulance. How was the patient moved to the ambulance? This is a multi-select, so it could have been a backboard and a stretcher. Position of patient during transport, supine. This is during transport to the hospital. How was patient transported from the ambulance inside to the hospital? That's going to be by stretcher. And if you were turning over a patient to another EMS provider, you would type it in here. Destination information. This would have automatically downloaded from CAD if you re-download CAD. Reason for choosing destination, the closest appropriate facility. Where in the hospital did you drop the patient off? 99% of the time it will be hospital ER, so this will be a default setting. If you diverted, you would choose from here. How was the patient when you left? Was there any patient belongings? So patient belongings, if you had some, you can choose them here, or you can just click none. If you were to click other, you would be able to type them in there. And patients left, the belongings were left with who? At the destination with the family, with the patient, whoever it may be. So we'll say at destination with staff, and we will medications. And now we are done. Your destination address should automatically have set. Then you go to your mileage, whatever your mileage was, you enter it here. Billing information. The previous time this patient was picked up, it was a self-pay, but you need to make sure that there is no insurance information. And at this point, you would pick whatever the insurance is. Then it will open up the rest of the tabs where you can enter the insurance information. If it's a workers' comp, put in the employer's information. Signatures. Patient signatures need to include the HIPAA acknowledgement, permission to transport, permission to treat, release for billing. If they give you permission to transport and refusal of treatment, you would not click that and you would give that. This will automatically set the time at the time that they sign, or you can click the destination arrival time and however long after that. If you get the patient's name, that's the patient. Type of representative would be self. And the status will be signed. If they refuse to sign, you can put that in there also. They sign it, you hit OK. The next signature is your primary crew member. That is the one that actually did the majority of the care during transport. So they will be signing, and who wrote the report. So report author, EMS provider, again the date and time, and auto-populate, sign, done. The next one will be the second crew member. Reason for the second crew member to sign is if they are witness to a refusal of treatment, but they're also an EMS provider, so they did some treatment. Again, date and time, crew member, sign. Next signature, if the patient refused to sign or was a minor or you needed a representative signature, unable to sign, this is where you would choose that, and you would choose the same stuff you would for the patient. Your hospital receiving agents. So if there was belongings, they'd be signing for this and transfer of care. Again, your times is when you actually are able to walk out of the hospital room after a report's been given. You're going to type in the nurse's name or physician's name, whoever received the patient. They sign. They hit this. It actually dates and times the exact time that they sign it. You're done with signatures. Now you want to go back to your narrative. If there was an AMA refusal for either treat and transport or assessment or whatever it may be, you actually have some AMA intervention questions. So what did you do to try to convince them? You tried to convince the patient, you tried to convince the family, you contacted the medical consult or supervisor, contacted law enforcement, and you can multi-select these. If they did refuse something, you would come over to the right side to the worksheet. There's an AMA form, refuse of medical care, transportation, and or. This is to refuse specific care, advice, or recommended destination. And this is a request to release, as I do not feel my condition requires emergency care. So this is a complete just, you think that they need it, they say I don't need you, and that's what this would be. You can free text a list of specific items that they refuse, the patient or the guardian's reason for refusing, who is with the patient now, if there is anyone, is the patient or guardian ANO times 4, is the patient not impaired by drugs or alcohol, are they competent to refuse care, and this all of this is for your records only. This is just a checklist for you to make sure that you do a complete AMA. Have they been told that they can call 911 again to be reassessed? Have they been given the risk of complications of refusing? Are they over 18 or emancipated? Was there any care given or BLS care entered? If yes, then just free text what you have done. And this is where the medic signs, not the patient. This is medic only. This is just for your records. The crew member who did it. Again, the times. So if it's during transport, you can go ahead and put that in there for the refusal of an IV. Now back to your narrative, you can enlarge this to where it's full screen. And you have a few options here. You can auto-generate which means that you can have already typed something in, and if you want to keep that and just add the auto-generated, you can add it above what you wrote, you can add it below what you wrote, or you completely overwrite what's in the system. So if you overwrite it, there's your narrative. If you wanted to check out a different one, there's that. And so on and so on. Just make sure if you're using the auto-generated narrative that you make sure that there's no open-ended statements, then everything's completely filled out. And then from here, we need to find out what the 1-point validation, and that would be the time that this would be the actual signature time that you got from the facility hospital. So at 12:30, and at this point you are 100% validated, and then you would post your report. This is what you'll see, and then you can just hit OK. And then close it out, and you're done. A couple of little key things is that this is the EKG download, and this is the same format as you would do from the old version. You would pick your event and you would load it. You can still transfer it to the cloud and bring it down from the cloud, because it's still, when you start working on the field bridge, it's going to be on that computer only. So you need to upload, if you're changing computers, and download it back. You can download the CAD as many times as you want. So at the end of your call, or when you're ready to finish your report, download your CAD to get your most updated times. Now the next couple of documents you see within CenterLearn will be reports that you need to add. We will be adding 3 records for new hires, and we will be entering 1 record for makeup CE.